So this is just genioplasty with jaw sculpting, but it's a major movement that we've done. வலி இருக்காடா? எடுக்குள்ள லைட்டா வலி இருக்குல? நான் ஒரு நிமிஷம்.
முடி வலி.
தெரியும்டா ஒரு. So he says that I'm pulling out some hair. Well, konchonda. So this is soaking now. So I mean, I keep saying this when I do for every patient. Anyway, to get back to what we've done. So we've done what is called as a safe, predictable, for life chin augmentation. I like to call it so because we're moving the bony part of the chin forwards. Along with comes the muscles that actually move the tongue a bit, the muscles around the lips. So the patient has, I'm going to put a little bit more for him. It's just, okay. So that, so maybe I can do this and then gate control theory. Okay. Okay. All right. So, right. I'm going to show you with the side view now. This is just 5 days. So just this today, and so you can see this. That's it, Babu. And you can see the improvement. This is 5 days. Look at this jawline now. And look at that. So we've got a nice full jawline for him. I'm going to move on to the other side. Hey, what is Parni? Side lo chuparu. A side lo chuchu. Terida. In the middle. So we're going to show you the this view. Also, there's a lot of swelling now. You see, all of this is swelling. This is just day 5, so a little over 4 days. This will all go in, and then you can see the chin where it was to where it is now. Yeah, so you can see the similar thing on this side. Straight jawline, nice projection of the chin, good proportional vertical height, nice horizontal projection. The mandibular grooving is going to happen. This is because of the edema. Once this happens, you get a nice mandibular projection, and that's going to match with his whole face. And so you can see here also now. Pardon? You will test it again. It's actually so yeah. So once it goes inside, then you can see the great improvement. So thank you. So what's essential here in genioplasty with jaw sculpting is a cut is made in the chin behind. So in this case we make the cut right from here. So then the cut is made inside, and this part of the chin actually almost extending to the body of the mandible. This is the chin, the front part of the mandible. This is the body, this is the angle. Now, even though genioplasty usually doesn't extend to the body, and extended genioplasty, then we have to do large movements. I even take it up the angle sometimes. So in this case, it's not all the way up the angle, it's in between, but well posterior to the nerve. The nerve is here. The mental nerve comes out from there, roughly, I'm saying. So the cut goes well beneath the nerve. So that's why you can see the plaster. The plaster where I put is an indication to know where the cut is. So if it's like this, it's roughly going to be here, the cut. And likewise here. So that's an extended cut. We've given him an extended cut because we needed more movement. We want more stability for the segment that's moved forward. And we've used 2 plates and 4 screws. That doubt is up. Wali irukka ipo the bone nade theriyuma yekka pannum konju kore irukku alla vikku koreyum bone munnadi illa theriyuma adha surgery pannirkom mulla porum வலி இருக்கா உனக்கு அதுல இல்ல அப்பா அம்மா என்ன சொன்னாங்க திருப்பி வரணும் ஒரு மாசம் கழிச்சு செக்கப்புக்கு அப்பாயின்மென்ட் எடுத்துக்கணும் டாக்டர் just give appointment so come back after 1 month and then